Niche stands for Nurses Improving Care for Health Systems, and it really is a program designed to specifically address the care of the elderly population over 65. And it's designed to take into account their needs, which are different and unique, and to develop programs and health around that will help us to be successful in them achieving the health that they desire. So that's what niche is. It came out of a university-based setting, was developed by nurses, which is why it's called nurses, but it honestly involves the entire care team. And it has been proven to be quite effective. It's a wonderful resource with websites and gives us access to surveys and tools that allow us to improve care. So I don't know. So the benefits that I can give some examples. It would be, for instance, the elderly population reacts differently to drugs. So a drug like Ativan that might be fine for you and I may not be fine for someone who's 70 or 80, and actually might cause just the opposite effect or cause an effect that would cause falls. So by being associated with niche and being a niche designated facility, we're able to partner on research that's happening across the country and learn how to avoid those types of complications for our patients. So that's an example of one. There's some exciting benefits to the staff. One is that it's really, if you think about what's happening in the country, where 30% of our community is going to be over 65, and certifications are so important, especially to nurses. They enjoy being certified in specialty as well. There really isn't a specialty that could be possibly more important right now than geriatrics. So by being a niche designated facility, we can offer certification in the geriatric world for the nurses, as well as our nursing assistants. Now, we can do that certification on site. We've already done that for 12 nurses who've been through the program, and we're getting ready to do that for a group of nursing assistants. Once they complete that on site, they can actually sit for the exam nationally and become certified. So they can utilize that towards their incentive points. Most importantly, it educates them on ways to help their patients, which is really what we're all here about. And it's interesting, some of the people that took that program, Karen Christmas, Sherry Witt, these are seasoned nurses. I mean, they have a lot of experience, and every single one said, I learned several things out of this class, or I learned a lot out of this class. So we all can learn something new. Well, I think the approach with niche is to, one, we did a survey to understand what are our perceptions towards the elderly. So do we have an underlying culture that would be of concern about our attitudes towards the elderly? Because if we have attitudes or beliefs or a cultural setting that is not favorable for the care of geriatrics, we will not give good care. Fortunately, we did beautiful in our survey. We have a wonderful culture here. So there were some areas that we were able to identify that we could improve on, which we will do so, and we have an action plan to improve on communication, management of sedatives, and a couple other areas that individuals will hear about over time. We can then measure our success because we'll resurvey our population, and we surveyed the whole hospital. So that's the advantage, is that it allows us to understand the differences between the elderly, caring for someone over 65 versus caring for you, and as a result, give more targeted care using best practice. The good part about targeting care for the senior population, we still won't go wrong with providing care for those under 65. So there are unique needs over 65, but if we meet those, we're going to meet them for the other ages as well. Sleep is really, really important to healing. You can't have surgery and expect your wounds to heal unless you have very good nutrition and you have rest, and that allows you to heal. Well, it's hard for anyone to rest in a hospital, but it's even harder for someone who may have a little bit of dementia or is away from home for the first time, may have other disease processes going on, which is typical of that elderly population. So we have instituted a program that promotes rest. It does two things. It encourages our staff to ask, how did you rest last night? Did you sleep okay? And if not, we have earplugs and we have earphones that they can use with their TVs to use healing music and calming music. And also, in addition to that, it also allows us to use lavender to just lavender's soothing and healing and relaxing and helps promote sleep. So we have a little packet that is now available in the Med-Surg unit that's targeted to assist with that type of thing. So mobility is another example, and you would think that we would be good about that. It's a basic nursing function, is to ambulate individuals, but it unfortunately is one that when time gets tight, it tends to be the one that we forget the most. And ambulation is important to keep the body regulated. It's also important to prevent dementia because it keeps the blood flowing. It also promotes strength to the best of our ability so that we can prevent falls. And it helps with stabilization and equilibrium. So we are not really doing that as well as we could. So we're instituting a mobility program where we're teaching our techs why it's important to ambulate and keep people mobile. And then we're utilizing our volunteers is our plan once we get our techs up to speed so that they can actually walk with the patient along with the tech or the nurse to make sure they're ambulating. So those are just two examples. There'll be many, many more as we continue this journey. Well, one of the things that Niche promotes is getting more involvement with our community members or our patients to get feedback. So a great example is that we're redesigning the second floor. In fact, we're pretty close to that. But we've been utilizing some outside volunteers and getting some feedback from patients as to what's important to them. Instead of staying focused on what we think is important, we're not the patients. Niche really promotes us going out and getting that involvement. So we're developing a patient advisory group who will be a standing group of previous patients, possibly future patients, interested parties who will work to review our construction plans. If we're putting in a new policy and we think that it warrants getting some feedback before we do it, we'll do that as well. We have an issue with quietness in this hospital. It's very difficult to maintain quiet, and our patients say so on our surveys. We can ask them why. So Niche really promotes patient engagement. It's something we talk about a lot, but we're not always really very successful in getting it. So this will help us with that. We were already designated as a level 1 niche hospital in our first year. Our goal this year organizationally is to become a niche level 3. That's a big jump, but it means that we have to have some performance improvement, which is already underway. I don't think that one will be a hard one for us. We do have to have our advisory group up, and we have to increase our number of certified nurses and techs. So it's a big challenge. Probably the biggest challenge is that we need to conduct sort of a regional level seminar or educational session that will educate people, providers in our community, on special needs of geriatrics. And we're really looking forward to that because the whole idea of Niche is to not just improve the geriatric care here at AGH or within our system, but really within our region. And we will be the leaders on that. One of the interesting things that occurred with our surveys, one, they told us that no hospital has ever surveyed the entire hospital. They suggested that we survey one unit at a time with a goal of about 50% participation. We said, no, we're going to survey everyone in our organization because we think we can do it. So not only did we survey everyone, doctors, nurses, registrars, finance, but we did everybody. But we attained a 71% participation rate. So our survey results were reviewed with us by a professor from Harvard who said that she had never seen such reliable results because our sample size was so high And she had never seen anyone attempt to do the whole hospital, which we did and did successfully. And so she said that she was also, what she really found enjoyable about AGH was that on so many of the surveys, because she sees them across the country, it's like, well, our staffing's not very good, or this is a problem, or that is a problem. Usually very self-centered type comments about staffing, or I'm not paid enough. She said she didn't see any of that in our survey. What she saw were great suggestions on how we could do better around the patient. And she said, I intend to tell them at the national level to watch out. They've got a little gem called Atlantic General Hospital, and they can learn from them. So we were really proud about that.